The golden standard of PD-L1 detection is immunohistochemistry, IHC. The manual operation includes 3 steps: slicing, staining and mounting, and staining is the most critical step, which requires dewaxing, antigen retrieval and inactivation, primary antibody incubation, secondary antibody incubation, color development, and counterstaining, etc. Currently, the staining can be completed by automated instruments, and the reliability of the results largely depends on the choice of primary antibody. At present, there are 5 kinds of PD-L1 antibodies on Chinese market, namely 22C3288, SP263, SP142, and E1L3N. When PD-L1 detection is used as an auxiliary diagnosis, there are corresponding requirements for indications and drugs. For example, when patients with non-small cell lung cancer receive pembrolizumab treatment, PD-L1 22C3 needs to be tested to evaluate the PD-L1 status. When TPS greater than or equal to 1%, PD-L1 is positive. For different PD-L1 clones, there are corresponding detection platforms, all of which are imported automation platforms. So-called the 3 mainstream platforms on market. Currently 22C3 and 288 antibodies are with Daco platform, SP263 and SP142 antibodies are with Ventana platform, and E1L3N is with Leica platform. Then how to select from these 5 PD-L1 antibodies for medication guidance? In order to explore the consistency of these antibodies, the International Association for the Study of Lung Cancer led the Blueprint project. The Phase 2 study showed that 22C3288 and SP263 in the detection of PD-L1 positive tumor cells have high staining consistency, while SP142 detected fewer positive cells and showed low sensitivity. The results of another multi-center study also confirmed this point. An E1L3N clone was also included in this study, which showed a high degree of staining consistency with 22C3 and 288. It is worth mentioning that E1L3N is currently the only domestic PD-L1 antibody in China. Then in the next part, we will introduce the PD-L1 antibody kit. Please look forward to the part 6 about PD-L1 detection kit of MEDX.